Ladies and gentlemen, in this video I will be showing you how you can prepare for exams using the NMCZ Ready app. So there is a section on the app called the Board Exams app, the Board Mock Exams app. So to get to this, you first of all have to open the main platform. That's www.nmczready.com. You scroll down to where it says Advanced Tools. Then you come to where it says Care Plan Generator. When you open this section, you will be redirected to this app. Here, you can open the three lines there and either open the nursing care plans or come to the board mock exams. So as we're going through this, be reminded that you will need to be an active subscriber on the platform to access the advanced features. But for demonstration purposes, I am still going to show you how it works. Right, so the exam preparation center, when you open, come to mock board exams, you enter a topic. So let's pick a topic. We want to revise asthma. So we say asthma. Yeah, let's say asthma and start quiz. So you say start quiz as it's generating the content right there. Let's give it some time. Meanwhile, I'm going to open the nursing care plans. I have generated some nursing care plans, specifically in pediatric nursing, prematurity. So I have a list of problems. I will pick the first one, and the first one reads: ineffective thermoregulation as problem identified. The nursing diagnosis is ineffective thermoregulation related to immature temperature control mechanisms and lack of brown fat as evidenced by temperature fluctuations below 36.5 and cool skin. In the exam, you might need to want to put a specific temperature below this one. Our goal or objective, which should be specific, measurable, attainable, realistic, and time-bound, abbreviated as SMART, reads: the infant will maintain an auxiliary temperature between 36.5 degrees Celsius and 37.5 degrees Celsius within 1 hour of nursing intervention. Our interventions read: I will monitor the infant's auxiliary temperature every 2 hours in order to detect hypothermia or hyperthermia early. There is rationales provided to why this intervention is correct. Remember, the intervention itself has the intervention as well as its rationale, which says in order to detect hypothermia. That's the rationale. What makes it correct has been explained here. Frequent monitoring allows for quick adjustments to the environmental temperature as well as to prevent cold stress. There are many other interventions. The evaluation: the infant maintained an auxiliary temperature between 36.5 degrees Celsius and 37.5 degrees Celsius within 1 hour. The goal was achieved. You might want to pick a specific figure between 36 and 37.5. An exact one. Do not give a range in the exam, but this is just for guidance purposes. There are many other problems. We have 4 actual problems and 2 potential, meaning you have 6 in total, though the examiner will only ask you for 5. Now let's get back to the exam preparation section. So we had said we're going to conduct an exam. So we said we're going to do asthma. Type asthma and say start quiz. The generation is now complete. So now let's begin. So we have 5 questions for each token that you generate. The first question reads: a client presents to the emergency department with an acute asthma exacerbation. On assessment, the nurse notes that the audible wheezing heard earlier has stopped and the breath sounds are inaudible. The client is struggling to breathe. What is the appropriate action? So when you're preparing for exams, let's say you're not sure what the answer is, let me show you what this platform can do. My most possible answer in this particular case, since the client is struggling to breathe, the priority is number 1, document the findings and continue to monitor. This is a red flag. Administer a prescribed rescue inhaler immediately. I'll keep this one on hold. Prepare for immediate endotracheal intubation and mechanical ventilation. And D, instruct the client to cough and deep breathe to clear secretions. So it says on assessment, the audible wheezing heard earlier has stopped and the breath sounds are inaudible. So meaning the patient is most likely not breathing. I'll go for endotracheal intubation. So if this is wrong, the platform will tell me. So the answer is correct. and it tells me the rationale. The disappearance of wheezing is associated with inaudible breaths in a client with acute asthma, which indicates silent chest as a sign of severe airway obstruction and impending respiratory failure. So we go to the next question. A nurse is teaching a client with asthma about a proper use of a peak flow meter. The client's personal best is 400 liters per minute. Today, the client records a reading of 220 liters per minute. Which action should the nurse instruct the client to take based on the asthma action plan? I'm not sure what the answer is for this particular one, so let's say I give it a guess. I go with the first one. So it shows me that my answer is wrong and the second one is correct. What makes my response wrong? It's explaining to say a peak flow reading of 220 is 55% of the client's personal best, which is 400. So the best place, this places the client in a yellow zone, which is 50 to 79% of personal best, meaning it indicates caution and worsening of asthma. The standard protocol for the yellow zone is to use a rescue medication, which is SABA, okay, which is fully expanded as short-acting beta antagonist. One of them is salbutamol. Salbutamol is short-acting immediately to open the airways. The green zone is 80 to 100% and the red zone is below 50. So we go to the next question. The next one reads, a client with a history of asthma is prescribed Montelukast. Which statement by the client indicates an understanding of the medication regime? So the first is, I will take medication as soon as I feel shortness of breath. A client with history of asthma is prescribed with Montelukast. Which statement by the client indicates understanding of medication regime? I should take this medication once daily, preferably in the evening. This medication contains a steroid, so I need to rinse my mouth after use, or I can stop taking this medication during summer months when my allergies are better. So here it says which statement best describes or indicates the understanding of the medication regime. So I feel like the answer is this one. If it is wrong, the platform is still going to correct me. So this answer is correct. I should take the medication once daily, preferably in the evening. And it explains why Montelukast, a leukotriene receptor antagonist used for the maintenance and prophylactic treatment of asthma, is typically administered once daily in the evening because asthma symptoms can worsen at night due to circadian rhythms, okay? Circadian rhythms. So it is not a rescue medication, okay? It is an oral tablet, not an inhaler. So rinsing the mouth is not relevant to prevent thrust, okay? So we move to the next question, and the next question reads, the nurse is providing discharge teaching to a client the nurse is providing discharge teaching to a client prescribed a metered dose inhaler, MDI, with a spacer for fluticasone. Which instruction is most important to prevent a common side effect of inhaled corticosteroids? So it says which instruction is most important to prevent a common side effect of inhaled corticosteroids. So one is shake the canister vigorously for 30 seconds before use. Inhale quickly and deep to ensure the medication reaches the alveoli. Rinse the mouth with water and spit it out after using the inhaler, or wait at least 5 minutes between puffs of the same medication. I'm going to go with this one to see if it's correct. And unfortunately, it says rinse the mouth with water and spit it out after using the inhaler. And it explains why this answer is correct. Inhaled corticosteroids like fluticasone can cause oropharyngeal candidiasis, which is a thrush, and hoarseness due to local deposition of drug in the mouth and the throat. So rinsing the mouth and spitting after use removes the residue and significantly reduces this risk, while shaking the canister is correct, which is what is up here. While shaking the canister is correct. Option 0. Preventing infection is a safety priority. So we have our reason there. And our last question, which is the fifth one, reads, a client is receiving albuterol nebulizer treatments every 4 hours for an asthma exacerbation. With assessment finding, which assessment finding should the nurse identify as a common diverse effect of medication? Which assessment finding should the nurse identify as a common adverse effect of this medication? The first is bradycardia and hypotension. The second is tachycardia and tremors. The third is drowsiness and lethargy, and lastly, hyperkalemia and urinary retention. Which assessment finding should the nurse identify as a common adverse effect of the medication? I will go with bradycardia and hypotension. The answer is incorrect. The correct answer is tachycardia and tremors. The rationale is albuterol is a short-acting beta-2 adrenergic and agonist. While it targets the lungs, it can cause systemic beta-adrenergic stimulation, so resulting in tachycardia, which is increased heart rate, palpitation, and tremors, or jitteriness. So it does not cause bradycardia, which is option 0, the first one I picked, or drowsiness. Rather, high doses can actually cause hypokalemia, low potassium, and not hyperkalemia, which is option 3. Finally, the whole purpose of such a platform is that it tells you what is correct and the reason it's correct, and corrects you when you're wrong. Other than you're taking a quiz, if you don't get certain answers correct, it doesn't explain to you why those answers are not correct. So you're most likely to make the same mistakes in the next exam if a similar question was answered, or asked rather. So to access the platform, like I had said, you start from the main website, which is nmczready.com. When you open the nmczready.com, you will be redirected to the platform when you open the advanced too. So until then, see you on the platform.